I've just come down from the car park there and I sat at the front entrance of the Manor Hospital. Through these doors it will take me through to the atrium where I will point out the route to ICU and the route to DPU. I'm standing in the main atrium and this is the way to ICU. Going up these stairs to the first floor will take me along the corridor to ICU. For those that don't want to take the stairs, there is a lift through these doors. I have arrived at the top of the stairs on level 1. For those of you that took the lift, over here will be the doors that you will come through when you exit the lift, and then you will come here to head down the corridor towards ICU direction. The doors here will lead you to Ward B. This is one of the respiratory wards in the Manor Hospital. And at the very bottom of this long glass corridor are 2 additional wards. Down this corridor here will take you to the route to ICU. So at the bottom of that short corridor was the very top of the stairs, which you just met me at, and I'm now going to take a left and go up this ramp, and this will take us to the building where ICU is housed. I've just arrived at the top of the ramp and came to the end of that corridor. Turning left will take me to the lifts and the stairs to ICU. If you are using the lifts, you will press for level 1 for ICU. So I've came to the bottom of the stairs over the 2 sets of lifts, and I'm now going through 2 sets of doors to take me through to the coordinator's office. If you turn right, that will take you directly into ICU, which will be a red area. For you starting duty, you will take a left and go to the coordinator's office. I'm standing inside the doors of ICU. To the left of me here is the main ICU unit, and this will be a red zone. To the right of me, on the right door, will take me to the coordinator's office. This is where I will find where I've been allocated for the day. In here is the coordinator's office. There will be a board in the coordinator's office that will show you what patient you'll be looking after for today. So go to the board, find out what patient you're going after, and then head up to the changing room to get changed into your scrubs. Just to point out, there is a staff toilet to the right of me here. Beside the nurse coordinator's office is the donning room. We will go through these doors to don for our PPE. Once we come back out these doors, we will head through the next set of double doors onto the main ICU unit. So welcome to the main unit of Manor ICU. This is bed spaces 1 to 6, with 6 being the side ward. So to the right of me here is the nurse's station and the procedures trolley. The procedures trolley is used for central line insertion and art line insertion. Beyond this area is the pharmacy room. The pharmacy room is a passcode. The staff will tell you what the code is to gain entry, and everybody carries a key with them. The CD cupboard is also located in the pharmacy room. Beyond that is the patient toilet, which will be out of bounds. The next door here is the sluice, and beside me here is the crash trolley, the airway trolley for intubations, and the arterial blood gas machine. Through this door it will take you to the equipment store where you will find ventilators, pumps, and any kind of ICU disposable equipment that you need. The next set of doors is the main store for ICU, where aquapack tubing, oxygen masks, given sets, anything that you need for ICU will be in that store. So I am now heading towards the doffing area of ICU. Another thing to note is these 2 doors here, that is our linen cupboard. This will take us to the doffing area, and it is also a fire escape route in the event of a fire. To the right of me here is the kitchen. There is a fridge in there for bottled water for patients and a freezer. Some of our patients that are intubated do like ice lollies, and you will find one in there. There's also a bin here, and that is for the first stage of doffing your PPE, where you remove your apron. Through these sets of doors will take me to the doffing area, where we follow the same stepwise procedure for doffing. This is the doffing area for the Mater ICU, and you can see here the bins will be used for doffing the PPE in the stepwise procedure that we've mentioned. There is also a bin here for samples, so any blood or other types of samples will be sent on a patient will be dispensed into this bin for collection via the nurse in charge. Once you've doffed all your PPE, the final step to complete is to wash your hands with soap and water. We will go through these doors and take the next left to use the sink. I have just doffed all my PPE, and the final step to do is to wash my hands. I will walk through here and use the sink and use soap and water, followed by alcohol sanitizer. The other thing to mention is the trolley for samples. So the clean nurse outside the unit will come around here, apply gloves and apron, and into the doffing area to pick up any samples to send to the lab. I've just came from that long corridor where the doffing area was. Just to point out, this is the stairwell here, and the fire escape exit will take you to the front entrance, the NE entrance on Cromwell Road. Through to the right here is the doors back to ICU, and most importantly to the tea room. I've just come through the doors where the lifts and the stairwell was, and I'm now going to head to the tea room. So the door onto the left here is the ICU tea room, and there's also a staff toilet as well. The next set of doors is a doctor's room, and that's where you will find anaesthetists and ICU doctors. So I've just had a cup of tea in the tea room, and it's now time to go back onto the unit. I'm going to head through these doors back to the coordinator's office and the donning room. Another thing to point out is the fire panel. This is where you will go to locate a fire within the hospital.